Thanks, Neil. That's the recording started.
That's great. Thank you very much. Welcome to the meeting of East Lothian Integration Joint Board on the 26th September 2024. The meeting's been recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018, and data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. Fiona, I'll let you go through the apologies and the roll call.
Okay, thank you. We have apologies today from Dr. Cassingelli, from Marilyn McNeil and from Thomas Miller. Are there any other apologies that anyone's aware of? Nope. Thank you. Then I'll move to the roll call of IJB members present. Shameen Akhtar.
Present.
Jeremy Finlay.
Present.
Lynn Jordan.
Present.
Carol McFarlane.
Present.
Jonathan Blaisby.
Present.
Patricia Cantley.
Present.
Andrew Cogan. No. Elizabeth Gordon.
Present.
Thank you. Maureen Allen.
Present.
David Binney.
I'm really glad my
Lindsay Byrne. Lindsay.
Present. Yep.
Thank you. Sarah Gosner.
Present.
John Hardman.
Present.
David Hood.
Present.
David King.
Present.
Claire MacDonald. Claire McIntosh. Fiona Wilson.
Present.
Thank you. And we also have Darren Bradley present here today, and his appointment will be covered in item 4. Can I ask if any members have any declarations of interest on any of the items of business? No, that's great. Thank you. That's us ready to move to the business chair.
Thank you. Thank you very much. Just before we start, I'd just like to welcome the new people that have come along today, to Darren Bradley, as you've mentioned, as a new member, and Simon Davies. So welcome to the East Lothian Integration Joint Board. We'll move on to agenda item number 1, which is the minute of the last meeting from the 27th of June. You all had the chance to have a read of a note of the minutes. Can I just check that you're content with the accuracy? Have any?
Happy.
Okay, thank you. We'll go through agenda item 2, minutes arising from the meeting. Any matters arising on page 1? Page 2. Just on page 2, there was a number of matters arising from the 23rd of May, and I think some of them we do need to make sure that we just carry forward. Just the Scottish Women's Budget Group work, if we're able to continue that forward, and if there's any update on the care at home services that were mentioned at the last meeting. Laura, did you want to come in on that one?
Yeah, so just to, I'm not sure if quite in relation to what you're asking, but certainly the Care at Home Change Board met this morning, and work is progressing. I suppose it's important that we're looking at, it's not just about care at home, but the whole way we're delivering those services and those things that are supporting to reduce the pressure on care at home. I think where we are now seeing that struggle with reducing care home placements, but also reducing care at home, and how we're balancing that and mixing that into the community. So I know Maureen, I think, is on the call today, was also at the board this morning, as were other GMs. So yes, work is still progressing and still looking at the bigger picture of delivery of services as a whole.
Okay, maybe I should use the word redesign of care at home services. Do you have a rough idea of the timescale of when you'll be able to present something to the IJB?
So based on this morning's discussions, we were looking at developing actually now a pilot within the Trinent area. I would hope that we would have some data and some figures on that, and see how that was looking, maybe by early into the new year. But again, I suppose what came across this morning was more about it's so much bigger than care at home, and I think we're being distracted by it being called the care at home change board, because there's such a need to make sure the assessment's right at the beginning, and then how people are flowing through the system. And the error is maybe our focus is on care at home, whereas it actually needs to be, okay, how is the small part of care at home playing into a much bigger picture? So yeah, I hope that I would have an update coming from that change board at the beginning of the new year, and I expect it to probably look very different. I don't know, Lynn was also there, she's maybe got further comments, but it's just feeling care at home feels that it's such it's an integral part of health and social care in particular, but we are looking at it or scrutinizing it when actually we need to look at the bigger picture, not get caught in care at home. We need to look at the assessment process, how people are coming into the system, and what our communities and what individuals themselves are able to offer, and what the offer is we can now present to people. So yeah, so much bigger, but yeah, Lynn's maybe going to come in with more coherent answer.
Okay, thank you, Laura. Lynn, did you want to come in?
I wouldn't say necessarily more coherent. I just wanted to echo what Laura was saying. I think having sat in on the meeting this morning, there was a very robust discussion around how this needs to progress, and certainly what Laura was talking about there about it's very easy to get sucked into the detail of it when we actually need to keep it quite high level. But I think you're right, Chair, to highlight that this is probably much more about a test of change of service redesign rather than something specifically just about care at home. So I'm confident that the work is progressing. I think that there was a degree of frustration earlier that it's maybe not progressing as fast, but I think the challenging conversation that was had earlier has moved that on.
Okay, thank you. Do we have any matters arising on page 3? Just on page 3, one of the areas about early intervention and prevention, one of the things that was picked up was the health and wellbeing groups that are part of the area partnership, and how do we make sure that they're linked into what we're doing. And I think at the time, Laura, you'd said that you were comfortable that they were able to feed into the IJB. So I think just making sure that we're keeping an eye on that they're able to do that.
Yeah,
Okay.
yes, I am. I think probably for noting, and not for the not for our action, but some of the health and wellbeing groups are better established than others, and they probably need further support. But I'm not sure how we would access that, and that's not something we would have capacity to do. But certainly we are involved in all of the health and wellbeing groups.
I think we could maybe get the key issues were the ones that are established, what the key areas of priority they're highlighting from those groups would be helpful. Yeah,
we certainly have that, and we certainly have officers involved in the groups and helping them.
That's great, thank you. Any matters rising on page 4? Just at the top of page 4, at the last meeting, we had a really good presentation from Ms. Goodfellow, and one of the things she talked about was baselining investment plan to see what is being spent on prevention and how this would be tracked. I think that's one of the things I'm quite keen to see what that means for us in East Lothian, because you had quite substantial figures on some of the, for example, when we talked about type 2 diabetes, of what was being spent and how we're able to track that money, and if the ways of we can ensure that it can be reinvested into early intervention and prevention. Okay, anything else on page 4? Page 5? Any matters rising on page 6? Page 7? And page 8? Nope. That's great, thank you very much. So that's can we approve the minutes of the last meeting? Are we happy to approve them? Is that agreed? Okay, I can see quite a few heads nodding, thank you. Our next agenda item is Chair's report, and it had a little bit of time just to reflect on what was happening, and I'll maybe just put it into two sections of nationally and locally. Nationally, myself and also Andrew Cogan regularly attend the network of IJB chairs and vice chairs from the whole of Scotland. They're virtual meetings, but they're really, really valuable, and I suppose it's really helpful to know the two priority areas of focus for the network is the purpose of the group is to share good practice. So one of the things we're keen to look at is good practice of how other places are looking at the redesign of services and delivering social care. And secondly is to influence and lobby at a strategic level. So for example, on influencing at a strategic level, we know there's been lengthy discussions with government about delayed discharge. So one of the key messages from the group was that how do we make sure that we can change the narrative, that it's not just focusing on delayed discharge, but it's focusing on the whole system, and it's focusing on early intervention and prevention as well. So if the network of IJB chairs or vice chairs have been asked to participate in anything to do with delayed discharges, they're really keen to make sure that we say, look, it's not just delayed discharges we want to focus on, but the whole system, because we can't influence delayed discharge as much as possible without looking at the whole system. There was a number of other things that have been happening. The National Care Service, we've got that on the agenda, and also just recently the East Lothian Council passed the Homelessness Action Plan, so that has a significant impact on the Health and Social Care Partnership in ensuring that some of the most vulnerable people have the appropriate accommodation or maybe on the homelessness waiting list at the moment. Locally, there've been quite a lot of other things that have been happening. I went along to the Care and Repair Advisory Committee. We've had the Care and Repair paper before to look at adaptation. So again, we're looking at ways that we can support the Care and Repair Board, but also make sure we highlight the issues of concern that they're raising at the appropriate levels. There was a number of local projects that I visited over the past few weeks, the Bridges Project and the AGM at Homestart East Lothian, and some of the key messages that are coming out that the individuals and young people and families that they're supporting, that health and well-being and mental health is a recurring issue there. So it's good to see that Jane Cunningham from the Health and Social Care Partnership has a mental health network where she's bringing together good practice just to try and disseminate as much as possible the information and the groups and the work that's happening out there, so that's disseminated as much as possible so people are able to access those services. And also just to see the good work of Headway. They had their 30th anniversary. I know Councillor Jardine was there as well, and looking at the work that they're doing to support people that have had head injuries, and that was their 30th anniversary. That was just most recently. One other thing I just wanted to touch upon was the iPavilion. We've recently seen that the iPavilion has been closed, and it's anticipated for a period of 6 months. And then from the 25th of October, appointments will be moved to other NHS Lothian facilities. So it's just making sure that any residents of East Lothian are aware of that there are other kind of venues in place to try and meet the demand for those appointments. The National Care Service I'll leave because I know we'll be discussing that on our agenda. And if anybody had any other any questions on the Chair's report. Okay. Just one final thing I just wanted to mention was the planning for older people services. Jennifer Jarvis has sent out quite a list of consultation events. So if you're able to attend, that would be appreciated, but also if you're able to pass on and share amongst your own network so as many people as possible are able to participate in those, that would be great. The first one is on the 28th of September and it's at Fisher Row from 11 o'clock to 3 o'clock. Okay. Okay, thank you. I'll move on to agenda item number 4, which is changes to the non-voting membership of East Lothian IJB. And is that yourself, Fiona?
Yes, thank you. Thank you. So the purpose of this report is to invite the IJB to note and where appropriate agree to changes in its non-voting membership. You will see the background around kind of the reappointments that have been made. The report has been discussed with the appropriate nominating bodies. We're not noting any policy implementations. It just meets the regulations and governance of the IJB. It doesn't require an integrated impact assessment and doesn't affect the IJB directions. And the recommendation is the IJB's asked to agree to the reappointment of Maureen Allen as the third sector representative, agree to the reappointment of Thomas Miller as the NHS Lothian staff representative, agree to the appointment of Darren Bradley as the East Lothian Council staff representative, note the reappointment of Claire McIntosh as a non-voting member in the role of non-GP medical practitioner, and finally note the appointment of Dr. Clondy Casangeli as a replacement for Dr. Philip Conneglan as a non-voting member in the role of advisor on public health. Thank you, Chair.
Do you have any questions or comments on that paper? No, I don't see any hands up. Firstly, I just want to thank the people that have stood down. Dr. Philip Congleton, who was a really valuable contributor to the IJB and also our development sessions, just to thank him for his contribution on the IJB and just to welcome all the other members. These are really important appointments for East Lothian IJB, ensuring we've got a strong third sector representative, the trade unions and NHS Lothian staff representative, and also practitioners like Claire McIntosh, who made really valuable contributions at our last finance development session, and to welcome Dr. Kalengi along to the IJB as well. So thank everybody for the contributions and to welcome all the new members. Okay, and we don't have, I just want to check there isn't any other comments or questions. I don't see any, so we'll move on to this paper. Requires a roll call vote, so I'll leave that to yourself, Fiona Curry.
Thank you, Chair. The recommendations are as set out by Fiona Wilson and they're in section 2 of the report. So I'll just come to each member. Shameen Akhtar.
Agreed.
Thank you. Jonathan Blaseby.
Yes, agreed.
Thank you. Patricia Cantley.
Agreed.
Thank you. Is Andrew joined us? No. Jeremy Finlay.
Agreed.
Thank you. Elizabeth Gordon.
Agreed.
Lynn Jordan.
Agreed.
And Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously, Chair.
That's great. Thank you very much. Move on to the agenda item number 5, which is the Unscheduled Care Lothian Strategic Development Plan. And is that with yourself, Fiona, and Oliver?
Yep. Thank you, Chair. So we've brought this paper and discussion to the IJB. Ollie Campbell, Strategic Programme Director for Unscheduled Care in NHS Lothian, is going to speak to it and hopefully open for any questions at the end. So I'm going to hand over to you, Ollie.
Okay, so thank you for inviting me here to speak about the Unscheduled Care Lothian Strategic Development Framework. I've got some slides that combine essentially what was quite an extensive slide deck that I'd sent around to the members. So I'll just run through these briefly and then I'm happy to take any questions. So let me just share my screen.
That's great. That's really helpful, Ollie. Just as you're going through them, one of the things I was quite cognizant of is some of those things that impact on East Lothian. So if you're able to refer what this means for us in East Lothian, that'd be really helpful.
Absolutely, will do. Okay, so in terms of unscheduled care update, so the LSDF stands for the Lothian Strategic Development Framework. So as a bit of context, this is essentially our strategy that defines how we want to achieve our aims within NHS Lothian, as well as the other partner organisations as they are co-signatories of it, i.e. the IJBs. And there's 6 pillars within this strategic development framework, and today I'm going to be talking about the unscheduled care element of it. The paper that I've shared did detail that we have done some revisions to the strategy since the last time you may have seen that. And the reasons behind these are as follows. So I will pick up slightly later in about 5 minutes time the changed and challenging financial landscape that has required us to review the programmes of work we have active and ensuring that we maximise these so we get the best outcomes for our citizens. The board was also in receipt of a number of recommendations that were received externally. So we needed to take those into cognizance as they weren't in the previous version of the plan. And equally, as these things happen, new programmes and projects do come along, and I don't think they were as expressed as explicitly in the previous version of the LSDF as we would have perhaps wanted. So that, along with doing a stock take of what did we achieve last year, allowed us to essentially review the programme in its entirety, and then I think streamline it into some more strategic groupings. So we were very clear about the outcomes we wanted to achieve, and therefore the strategic groups that we were going to put into place and refine in order to develop them. And what I've shared along with the paper is also the LSDF, and we're calling it the implementation book, that tries to pull together all these different work streams into one slide deck with externalized links. So it's trying to be the font of all knowledge if you're wanting a quick glance at things to do with unscheduled care within the Lothian health and care system. So as a sort of easy starter for 10, the key things that we're trying to nudge the needle on or improve in relation to unscheduled care are reducing emergency department attendances, reducing length of stay, and reducing hospital admissions. Now, I think it's appreciated that in order to do that, there is a whole system effort required. So whilst those indicators are hospital focused, actually it requires a whole system to try and move those and provide better care in line with that. So I've talked about structural revisions in the paper in details in a table, all the different groups we've put in place, revised and tightened up the objectives for them. So this is a visual expression of that. So we've got a navigation board, and I suppose the key headline in a sentence for that is ensuring that if someone does need urgent care, we can navigate them to the right part of the system, be it community support or be it the right part within the acute system, as we realise that's, or we appreciate that's very large. The OT and PT implementation group, in a sentence, that is looking at our allied health professionals, so our therapy staff across community and acute, to ensure that the models of care and the management models we have in place are best suited to impact and effectively manage flow. We've got a discharge without delay programme board, which is essentially executing the Scottish Government discharge without delay strategy, which is focused on process improvement, especially at the interface between acute and community, to try and reduce length of stay and improve patient care. We have set specialties within the acute sites, length of stay targets. So all the specialties within those sites should now be familiar with the target of length of stay they need to work towards. And we're kicking off QI programs within each of the directorates to support that. We have the Interface Care Programme Board, which is chaired by your very own David Hood, which is looking at essentially, I've already said that interface, but really we have hospital at home, we've got other pockets of interface services, and we also have our rapid assessment care unit, which are all essentially alternatives to being in a hospital bed or emergency department. But we acknowledge we need to ensure that getting into those services is as streamlined and simple as possible. And we have started, and this is one of the new boards, and I'm quite excited about this, a frailty programme board, which is looking at what is our offer for frail patients across Lothian, and that's meeting at 3 o'clock today. And then there's an early supported discharge group, which is looking at how best, again, that interface can work between health and social care partnerships and acute to try and get people out the hospital when they have been admitted. What we really don't want them to do is to be admitted into a downstream hospital bed when there's no requirement for that to happen, because we know that will elicit worse outcomes for the patient. So in order to understand how all these groups are functioning, we've also created a measurement framework that I've detailed in that pack. So as you can see at the top of the screen, there's some outcome indicators about what we want to achieve in totality for the programme, but then we've split it down by each of those themes, so reducing attendances, lengths of stay and admissions, and then we've gone further and say, well, actually, this is what each of these groups are responsible for delivering. So we've managed to sort of map down from the outcome indicators of the total programme down into what each of the groups are specifically responsible for. And the next couple of slides, I'm not expecting you to take in the numbers, but I suppose I'm just trying to give you assurance that we do have a mechanism now for understanding how the programme is functioning in terms of data. So we've just launched a live dashboard that, as you can see, it relates to the slide I've just showed. So we've now got our overarching performance indicators, which update on a weekly basis, along with our attendances, occupancy, and also the other things about improving the patient journey. So I think this has taken the programme a step forward, because I'm a huge fan of data, and I feel if we can't measure things, we can't manage it, we can't inform change. And in particular to East Lothian, this is the landing page. We've then got further pages which then detail each of those different parts of the measurement framework I was articulating earlier, but expressed as, well, this is how the sites are performing and this is how the partnerships are also performing. So you'll notice as well, and I suppose it's a very positive message currently in East Lothian, in that East Lothian do tend to benchmark on very favourably in comparison to the other partnerships. So how we've also tried to do it is we've tried to standardise some of these performance indicators by population, using the adult population as a essentially a rate. So as an example, you can see in this particular slide, if you look at the total occupied bed days for all inpatients and unplanned inpatients, even in fact just about all of these indicators, East Lothian benchmark below their peers in terms of the partnerships. So whilst that's great, I suppose the message I'm trying to get across here is I think we've now got a dashboard where we can identify, are the programme boards having the impact we want? And equally, how is that playing out within each area within the whole system? So that might be an acute site. It might also be one of the health and social care partnerships. I referenced earlier in the presentation about the changed financial landscape. So this will be no surprise to you, and this will not be new. Our gap in terms of finances went from 3% to about 7% in December. That, whilst we were at 7%, some boards ranged up to 14%. So I suppose it's just highlighting there's significant financial challenges across Scotland at the moment. NHS Lothian is not immune to that, and we still have a considerable financial pressure. A lot of that you'll be familiar with the reasons why, so I won't necessarily talk through all of these bullet points, but I suppose I'm just flagging there is a tension between finance and performance. There is a statutory responsibility to break even, as you will all know. So this gets us into the position of we have X amount of money. It is quite a lot of money, but are we spending it in the right places to get the best outcomes we can for our citizens? So in terms of the finances, in the middle section of my paper lays this out, which is historically, Scottish Government have given us 5 million, and that's for improvement projects. And historically, we've, as a programme board, allocated about 13 million out into business units. And this year, for example, in order to try and balance the books financially, what we've had to do is essentially look at how we are spending that 5 and 13 million and come up with ways how we can spend it differently. And some of it might be not doing things that we committed to doing previously. That is, I would say, not a sustainable way to try and save money or to build a system which elicits the best outcomes for patients. So what we really want to do is look at that 300 million, so the total portfolio of money spent across NHS Lothian and its partner organisations around, and that's the health spend, just for clarity, not the social care element of it. But there's a conceptual idea about how do we spend that money differently to get the best outcomes. So just to illustrate what I'm talking about here, so at the moment we've got a forecast 10 million overspend within the unscheduled care pillar, but what we are able to do is map out, well, where is that and how do we spend that 300 million across the piece? So as you can see, there's about 50 million in the front door, 50 million in that interface care space, and there's about 200 million in the hospital-based list of services. So the reason why I've showed you this slide is just so you can remember the rough shape of those three graphs. And you'll understand why after the next slide. The reason why I'm talking about the money is, suppose I'm just, and it goes to your point, Chair, about, well, how does this affect East Lothian? So the IJBs do have a role in unscheduled care. They're in charge of strategic planning and commissioning. So there is a significant amount of the set aside budget within IJB land is actually delivered within acute. So I suppose there is a question about how does the IJB go about its business in terms of commissioning and trying to improve the outcomes for patients within the services it commissions, both locally in the community services, but also within the acute services. And you'll remember that graph I said, I hope you've remembered the shape of it. This is the presentation I'm about to give to the frailty group, which is essentially a very visual way of trying to articulate what we're trying to do and elicit conversations about in terms of the finances. So here's your 50 million interface, 50 million front door and 200 million hospital care. What we've historically done, and I've just sort of articulated with that 13 million and 5 million, is we've, tried to find savings in amongst the system, perhaps where it was easy to do so. However, what we're going to need to get up into is the space of saying, actually, let's look at the whole portfolio, right? Let's then try and put some money to the side, albeit hypothetically as a tabletop exercise. And then let's work out what is the best model of care that we can develop with the funding that we do have available. And that might mean shifting some of the money about the system. And that's, I suppose, where the key message for how does this affect East Lothian comes into play. And that's where in the paper I've put actually the IJB to consider their role as unscheduled care commissioners. So what this slide is trying to elicit or allow people to start to get into the space of is, we've got money in lots of different places. It might not be, if we were designing the system for afresh, where you'd put that money. And some of it might be actually, in order to have a really strong unscheduled care system, you might need to strengthen the primary care element of it, or you might need to strengthen the social care element of it. So that's what I'll be challenging people at 3 in the frailty programme board to start thinking about, which is actually, hospital-based is not always the answer. So how do we create a much more robust and sustainable system using the money we do have? So the recommendations I put in the paper was, note the progress made in terms of the development and implementation of the unscheduled care pillar of the LSDF. Note how the changing financial landscape has prompted a bit of a revision of this, along with other reasons as well, and ideally support how we are approaching that challenge with a sort of streamlining of strategic groups. And then finally, as I've just laboured the point, consider the role of the IJB and how you want to commission the unscheduled care delivery, and how best you can use those powers to do so. And I'll stop sharing my screen at that, and happy to take any questions.
Thank you, Oliver. This is quite a substantial paper and quite a substantial piece of work. We could spend the whole meeting on this, but I think it'll be something that we need to come back to, Oliver. So thank you very much for that. Elizabeth, did you want to come in?
Thanks. Just had a question. Thank you very much for that report. That was really informative and very comprehensive. I had quite a technical question. It was about rapid assessment in care units as it affects residents of East Lothian. Is an East Lothian resident just as likely as an Edinburgh resident to end up in the RACU, or does the geographical issue mean that becomes less likely? And do they also end up being sent there by their GP? Thanks.
So in theory, what should happen is they should have exactly the same opportunity to attend RACU if they need it, because if the GP is calling the flow centre should have access to the capacity at RACU. That is something, I'll be honest, we are looking at through the RACU group, and that will feed into the group that David chairs, the Interface Care Programme Board. So I think it's a very valid question. On paper, it should be, but I would like to be able to offer that assurance with data as well.
Okay. Do you want to explain what RACU is, please, for new members?
Yeah, sorry.
And then I'll let...
So a RACU is a Rapid Assessment Care Unit, right? That is essentially an alternative to arriving at the emergency department. So if there is a series of conditions where otherwise you might have ended up in an emergency department, this is essentially like, think of it as a big unit that runs hot clinics. So you're able to go in the same day or very quickly the next day for a series of investigations that otherwise would have been done within that 4-hour time period, or supposed 4-hour time period, but in a very busy emergency department setting.
Okay, thank you. I'm bringing John Hardman and then Jonathan Blaisley.
Yeah, thanks, Chair, and thanks, Ollie. I had to look up RACU because I didn't know what it meant. I'm a clinical director and a GP, but I think that probably means the reason I don't know what it meant is because it encompasses a few different services across different hospitals, and my portal to get into those is to go through Flow Centre, and on a number of occasions over the last few months I've admitted people. I try not to do that very often, of course, but they have often ended up going to different hot clinics and services. So I think those access routes are working, and are being used by GPs in East Lothian. Thanks.
Thank you, John. Jonathan?
Yeah, hi. Yeah, thanks. I mean, obviously this is quite a complex area, and I guess I just want to kind of step back a bit and understand what we are sort of trying to achieve here and what the question is for us as this IJB. I mean, we're just one part of this is a pan-Lothian issue. So I guess I'm struggling with understanding what an IJB, what's within our gift and what we're being asked to do specifically in a very complex area. And how one of the asks is us essentially approving or assessing the revisions, and I'm not quite sure how to do that in such a complex area. How we are really, in a position to make that assessment for you. Although I guess just stepping back from the detail a bit, I'd just like to sort of discuss that if possible across the group, just so we make best use of this time.
I was going to come in, Chair, if that was helpful, just from a...
Yeah, come in, Fiona.
So no, it's a good point, and what I did have my hand up was to really say, just as we have had discussions in our last development session around set aside and direction, and we're going to have at the tail end of our development session at the end of this is about us influencing. We commission these services in the acute hospitals, and around us kind of one, being assured of the processes that is happening and what the work that Ollie is taking you through. So it's about that level of assurance, and actually then taking it back to our strategic plan around how it all fits. So care close to home, access to services. You don't need to be in a hospital bed. You should be in your own bed. All of that. And I suppose what it's asking IJB members as part of this engagement conversation is actually challenging yourselves, is the programme doing that? And as part of unscheduled care, how do we influence it? So it all sits, John, within that set aside, this budget that we hold, and some of that we get into later. So I guess a question could be for us around care of the elderly services. Actually, is there a better way of managing it from what we've picked up? Is there a way we want to direct it, and then how we influence directions? All of that falls into the mix of us you as a collective, as IJB, around how we want to commission things. So part of the programme that Ollie and I lead on is looking at that aspect of unscheduled care. But what we can't do is do it in isolation, and we need to bring it to the IJB. So it can't just be an NHS Lothian. It has to come and be docked. And I think this is maybe the first one, Ollie, you've been at just around this, docked, so that IJB members are aware. Because when we get into the point of actually what are the things that we're going to direct or stop or change or influence, we need to understand some of this. So I hope that helps, John. I suppose it was a bit of a woolly answer back, but it's again your role of assurance, how we commission as an IJB, and your understanding of the system.
Yeah, I guess I'm just struggling here. I appreciate other members' kind of comments who have more experience. I've recently joined, Shameen and Elizabeth also alluded to kind of this East Lothian context, and the paper doesn't, I don't think it really does that. It talks really on pan-Lothian basis. So in terms of getting assurance from an East Lothian basis, which is why we're here, I'm kind of struggling to know how we get that assurance based on what we've seen so far and what you're asking of us through that. I'm not trying to be difficult. I just struggling with that whole what is it we've really been asked to do, and how we should look at those principles that you probably outlined there, Fiona. Sorry, maybe this is just me being a bit thick. I don't know.
No, it's a legitimate question to ask, Jonathan. I don't know if Oliver or Fiona, you want to come in that one?
I mean, I'm happy to, but Fiona, I don't want to step on your toes here.
No, I'm happy. We can do a bit of a joint. I suppose what we are keen to do, Jonathan and IJB members, is make sure you as an IJB are aware the steps this programme is taking, because it is influencing. It's part of the set aside and how we commission. So that's the reason Ollie's here. We've not got right into the detail of East Lothian's performance. Ollie's shown it in a snapshot, and that's what we've done through some of the programmes we've done within the IJB. We can definitely bring something back. I'm not so sure that's for Ollie to do, but perhaps more us as an HSCP. But again, it's this just ongoing engagement because of the way we commission and the set aside. I don't know if you want to add to that, Ollie.
Yeah, there was a slide in my presentation, I'm happy to circulate again, that detailed the IJB's responsibilities in relation to unscheduled care, and they were twofold. They were essentially the performance scrutiny as well as commissioning, right? And it was also a governance component of it. So I suppose and you're not going to be able to probably do this now in the next 5 or 10 minutes, but from a developmental IJB perspective, there is an element of actually, how do you scrutinise unscheduled care performance, as that's in your gift/roles as that integrated joint board, and how do you then assure yourself that the models of care that are in place across the whole system, including what is being delivered in the big bad world of acute, right, aligns with the principles of how you would want unscheduled care to be delivered for the residents of East Lothian. So that's where you get into the commissioning component of, within that 300 million, you will have a percentage that is in your budget line. Is that being spent in the way that you feel will get the best outcomes for the residents of East Lothian? And I think that is a big question, and will probably take a bit of time to get people into that space of thinking about it, but that's the question I'm trying to pose, of that's where we need to get into.
That help, Jonathan? I think from your questions, Jonathan, this is something we'll have to come back to and then drill down on East Lothian, because what you're saying is that 300 million and that 55 million that's spent on the front door, who are the people from East Lothian going there? Why are they going there? And is that the right place for them? And if not, how do we shift that? And if you're saying there's a genuine commitment to shifting that, which is the whole point of integration from day one, then that'd be really welcome. But I think from your questions, Jonathan, we need to come back to this.
Yeah, I mean, it is
to drill down
on
East
well,
Lothian.
Yeah, I think so. I mean, it's around sort of settings, principles, the directions, and just how it relates to us in the IJB here. I mean, I assume this has been done plenty of times before, but not necessarily for unscheduled care. So no doubt members are familiar with how how we do get assurance for these types of papers and questions. I don't know. This is just because in unscheduled care here, that's not so relevant. So I appreciate other views, really, because I'm as you can tell, I'm struggling to understand kind of how to provide any valuable feedback here. It looks like quite a complex area. Clearly, a lot of structure, a lot of work being done in by the teams. I get that, but I'm just beyond kind of noting what you've presented. I don't know how to do more than that, I guess, is where I am at the moment. But I don't want to kind of make a meal out of it, or make work where it's not required in terms of our role as an IJB.
Okay.
Yeah, if you see that. So I'll leave that with you, Shameen.
Okay, I think what you've highlighted is we do need to have another session to drill down that shift that we need in East Lothian. And this is the first time we've had this. I'm not aware of having this type of paper before. And Ollie, you've talked about social care, primary care, but also I think in the mix of voluntary and community sector as well, when we're having that conversation in East Lothian and the valuable contribution that they can make. Does that help, Jonathan? I think you're asking legitimate questions, and it's the first time that we've had a paper like this about unscheduled care. So
okay, no, okay, yeah, that's fine. Okay, I'll let others comment. Yeah,
Fiona, did you want to come in on this point?
Yeah, I wondered if there's something, because it is the first time, and I was keen to push that this paper was brought here, as was Ollie, just so that the kind of inclusion, and it wasn't just an NHS Lothian approach. I wonder if there's something, just as a development session, we could do something on this, and I'm sure Ollie would help out as well. But remember, this is one programme of many, so it does ask a question of actually what else would be quite helpful to bring here. So not to confuse you further, Jonathan, but I suppose and the chair's right, this is positive it's here, but I wonder if development session might be helpful, Chair.
Yeah, I definitely think so. That'd be helpful. Lynn, you've been patiently waiting to come in.
I am patient. I'm also patient further if John wants to come in ahead of me. No? Okay. I suppose I just wanted to sort of reflect on some of the conversation that we had at audit earlier in the week, and that was around that shift of priorities to how much more effective we might be able to be in terms of the public purse around prevention and community sort of delivered initiatives, avoiding the need for acute as much as possible. It certainly sounds as if that's where this paper absolutely sits. I'd be curious in the development session to understand better how that top slice, if it gets redirected, could be redirected more into the areas where we do have more direct influence over what's delivered and how we connect it with the third sector and others as well, with more locally, to make sure that we've got that community-led care perspective within that. So that's all I wanted to say.
Oliver, did you want to come in to address
Yeah.
Lynn's point?
Yeah, so I was just going to say, absolutely agree with everything you said there, Lynn. Just a point of clarity about the top slice. All I've put in there was a hypothetical way that we could get into having a look at that. I was quite conscious that if we start with the conversation framed around what can we stop to release money, immediately everyone becomes quite tribal and parochial, and you can not do anything. So I was suggesting, why don't we take the approach of indiscriminately top slicing everything, trying to come up with a vision about what we would want to design, right? And then almost at the back of that process think, okay, well, what would need to change in order to make that vision happen? And yes, it'd still be a difficult conversation, but I think framing it like that might allow us to get into a different space without going tribal in the first instance. So I just want to clarify that top slicing concept was more a hypothetical approach.
Yeah, and that chimes very much with what I was commenting on in terms of Laura's expression of where the Care at Home Change Board is. It is really about trying to service redesign, but you do kind of need that impetus for, this is why we've got to do it, because we've been trying to reshape care for quite some time and not necessarily gotten as far with it as we maybe could have done. Because there's been those, as you say, those challenges have come in about, well, this is the way we do things and this is how we want to continue doing them.
Okay, thank you. John?
Yeah, thanks, Chair. I guess going back to what the other John was asking about what the IJB is being asked here, I guess my reading of the original paper was when I saw that first top slicing slide, my immediate question in my head was, how on earth are community services, primary care services, GPs, third sector, care at home going to cope with the reduction in unscheduled care and more care being provided in the community without extra resource? So the big thing for me from this is the fact that there is the potential for some of that set aside for the first time that I'm aware of any real consideration of that being shifted into the community. So that's the big thing for me from this. And my brain's gone blank. There was something else important I had to say there, and it's gone away. No, it's disappeared. Sorry.
It's all right. Yes, I think what you're just saying is that we're hearing, Ollie, there's a genuine commitment to shift, which is something that we haven't seen or kind of engaged with or talked about before. So that's really positive. And I think you've mentioned about the 5 million investment. I don't know if that's additional investment that would enable you to protect some of those care at home and voluntary and community sector, or is that just put into the mix?
So a couple of brief points. So yes, there is a commitment to have a look at this in an honest and serious way, and thus why we got agreement on Monday. The first place we should probably start is frailty, given that these are a huge number of the complex patients that requires a whole system response. And often I think, and there is great evidence with certain GP practices in certain areas who have tested frailty models, there's a great evidence base for actually looking at the models of care we've got. So that's where I'm about to take it in 10 minutes. In relation to that 5 million, that is a non-recurring pot that we get every year from Scottish Government, that has historically come with a series of asks, ascribed to what that's to be spent for. So it's in the mix, but that's where we're keen to look at the total portfolio spend as opposed to these pockets of money we get that are pretty much prescribed what we've got to spend it on.
Okay, thank you. John, did you want to come in?
Yeah, sorry, I just remembered what was the main point of what I was trying to say. So if you imagine I just keep talking, clearly the East Lothian perspective here is very important, but my understanding is what we're being asked for is to look at the IJB's wider Lothian-wide responsibilities and our strategic responsibilities. And my guess is that you're looking for all of the IJBs to agree on this as a general way forward. And if we are, and we're willing to go there and have those difficult decisions and those difficult conversations about the set aside, then that gives the Unscheduled Care Board permission then to take that further.
Yeah, I can see Oliver nodding that correct summary of what you're trying to do. You're going to go around all the IJBs to do that. No, I really welcome the opportunity to shift, but making sure that it is as mentioned earlier, about the whole system, not just the NHS, but social care, primary care, and voluntary and community sector. One thing I'll just leave with you, Ollie, just maybe you could come back on this, is we just recently saw about the kind of research about misdiagnosis of women going into it around heart conditions. So I know in here it says a women's health plan is to be confirmed, but there's no explicit recommendations from the Unscheduled Care Board. I just wondered, is that something that you'll be going back to look? So if that is just kind of homing down on who's coming in and specifically homing down on gender, that it might be things done differently to try and prevent hospital admissions.
Absolutely. So it was TBC in there just because the series of recommendations by Scottish Government didn't have anything pertaining explicitly to unscheduled care, but I'm quite conscious that will be a myriad of things that actually, through the lens of gender, that we can approach. There is a recruitment piece underway to get someone specifically looking at women's health, and they will sit in planning, and obviously we'll have links to me and scheduled care and all the other things. So I see that evolving in the coming months of what the women's health component is expressed in unscheduled care.
Okay, thank you. Just want to check if there's any other questions or comments. I don't see any other hands up. Okay, thank you, Oliver, for the paper. I think we're just want to see a genuine engagement and a genuine commitment to seeing that shift. And it's something that we've talked about. Integration was about at the very beginning, and just how we make sure that we include all of our partners within East Lothian when it comes down to drilling down on what East Lothian IJB is able to influence and shift. Okay, thank you. And what we will pick up, Jonathan, is a development session on this, but from the perspective of what's happening in East Lothian and how we can better understand who's going to the hospitals from East Lothian, why are they going, and what else should have been possibly could be available to prevent them from going there. Okay, that's great. Thank you very much. This paper is just for noting, so there's no roll call for this paper, but we'll take a note of organising a development session, Jonathan. Okay, and hopefully we'll see you back, Oliver, again. Okay, thank you very much. Okay, we agreed to note this paper. Okay, thank you. Thank you. We'll move on to agenda item number 6, which is the Q1 finance update, and that's from David King.
Thank you very much, Chair. As you said earlier, we had a finance workshop earlier in the month on the 5th. And one of the things I was keen to do was to write some of these things down, because it's very, very important we record all the Q1 position and the various bits and pieces that came out of that, and also to reflect a little bit on that finance workshop. And as I hope we'll have time for further discussion, as it says in the agenda, further discussion at the end of this meeting to talk a little bit more about these things, to provide you with some kind of background and some kind of information just to be going on with. So, recap for colleagues who weren't available, didn't manage to come along on the 5th. As you know, we set a budget at the beginning of the financial year, at the tail end of last financial year for this financial year. we had a gap, a financial gap of around about £10.8 million, and we set a whole lot of recovery schemes in train to try and close that gap. Now, interestingly enough, given our previous conversation, we parked the set-aside gap. Notionally, we parked about £1.4 million of notional, I must stop saying notional, of net set-aside gap, although there were all sorts of recovery schemes built into that gap. And clearly there are serious challenges in set-aside. We know that from the Q1 review, which I'll come on to in a minute. But I kind of reflects back on what the conversation we were just having. No one IJB can sort out set-aside. All the IJBs working together required to do that. And as you've said yourself, Chair, it's something we've been trying to do since the beginning of this whole process. And perhaps Lynn mentioned the discussions we had at audit and risk, and I've sort of included that as part of the discussion we'll have, I hope, later on after this meeting. Anyway, to come to the point, we set a target and we got Q1 report from our partners. The Q1 report says that the health part of the budget's overspent by about 3.2 million, and the social care part of the budget's overspent, coincidentally, by another £3.2 million. I've put in the month 4 position, but since we've done this, we've now got a month 5 position. And one of the things we've discussed is to make sure that the IJB is constantly getting updated in the financial position. Now, I appreciate we are not a board of management, but this is our budget and we need to be absolutely not cognizant of what's going on with it. What the month 5 position shows is the health position has got worse. The core part, because if you look at my wee table there, you can see the core part's breaking even in month 3. The core part is deteriorated by over £1 million. That is a reflection of the prescribing budgets across NHS Lothian. Between Q1 and month 5, the prescribing budgets across NHS Lothian are now £4 million more overspent than they were at Q1. So there's a very, very significant prescribing pressure in the system. Now, colleagues are working away to try and understand why. I mean, you know, GPs aren't writing scripts out to pass the time. Why is this happening? Is this a reflection of the pressures in the system elsewhere that are now being met through GP scripts? Or, and also, I should say, is this growth demand that's coming through the system? We know our populations are all growing across Lothians. Ours are growing quite significantly. There's a whole series of challenges around price. There's a drug called Pixaban, which apparently the price was supposed to drop, and it has not. It has gone back up. So there's a lot of information out there, and I'm going to get provided with that intelligence, so we'll come back to the IJB and have a further discussion about it. The other side of that particular thing, of course, was set aside. A set aside position in month 5 is not much worse than it was in month 3. Q3, these are forecasts. I shouldn't say month, I should say forecasts. The forecasts are done at the end of Q1. They're done in from a 4 position, they're done in the month 5 position. When I talk about these positions, I'm talking about the year-end forecast. It's the outturn, the 31st of March 2025. So set aside is really challenging. I was very, very pleased here to the conversation we just had, and the chair recommending, I think we've all agreed that we'll have a further workshop and set aside and tackle that whole issue. What is set aside all about? Set aside is those functions that have been delegated to the IJB, over which the IJB therefore is responsible for instructing the health board as to how to deliver them. And that money has been in our system from day one. That money has been historically overspent. We have got involved in a whole lot of other issues. And now I think we need to come to deal with this particular issue. So I think that's really, really useful. There's a little bit of chat in the paper about the 5-year plan. I've got the current 5-year plan, as I said, the workshop. What we now must do is revise that 5-year plan. There's a lot to come back to, in October. We'll need to come back to the 5-year plan again with a view to publishing a sort of a new 5-year plan, if you like, for December IJB. And again, you can see there's pressures in there. So if you kind of summarize all of this up, what it says is, we're sitting on a £6.4 million pressure now, and there are further pressures in the next financial year. So we're now putting together some kind of significant recovery package. Now, there are reserves. There's a little paragraph there explaining about the provenance of the reserves, and I've sort of gone through that a little bit. I sort of skipped over the set aside a little bit at the beginning, and I've put in a paragraph, and I've asked 3 questions. Why is it overspent? What can we do about it? Kind of feels back in this conversation we just had, and much more importantly, what's in it for us? I don't mean that in a kind of selfish way. I mean, how can these resources be better deployed? And in our head, that would be in the community. So these conversations need to take place, I think, There's a whole series of further risks sitting out there. The big one looking at us in the face at the moment is the pay awards. So NHS has settled 5.5% pay award. That's absolutely great. The Scottish Government have said that they will fund that. Now, I don't mean that to sound unkind, but funding these things is not necessarily giving us all the money that's required to pay that particular pay award. So there may be a financial challenge in there. Had a very useful conversation with Sarah last week about the pay awards in the council. Again, the pay awards in the council are going to be beyond the estimated element. So at this particular point in time in our budget, there's a provision for 3% pay awards. First of all, the Scottish Government have said, well, we believe that the provision in your budget ought to be in 3.2% pay awards. And you never quite understand why all these things is, but of course, 0.2% across the whole of Scotland is a great deal of money. But what they're going to do, perhaps, and I don't mean that again unkindly, because this money has to be found from somewhere, is they're going to attempt to do what they did last year and the year before that, and fund the councils for the difference between 3.2% and whatever the pay award actually is. And again, that's going to be a difficult thing to deliver. And we will have to have a conversation with our colleagues in East Lothian Council to make sure these funds are passed on to the IJB. So what happens next? There's a whole lot of stuff we're going to talk about, I hope, at our next workshop. The UK government is going to publish its budget on the 30th of October. That's obviously got a huge influence over what happens everywhere, since the Scottish government gets its budget from the UK budget. And the Scottish government will publish its budget on the 19th of December. And then there'll be a usual bit of shilly-shallying after that as to what these things actually mean in terms of hard cash. Excuse me. One of the other questions I asked, I think somebody asked, it may have been yourself, Chair, somebody asked me this. There's a Cabinet Secretary made an announcement 2 or 3 weeks ago about various financial pressures in the current Scottish Government's financial position. And I asked NHS Lothian, is there something going on out here? Are you going to be having to reduce our allocation? And I asked Sarah the same question. Now, the short answer to that question is no. But the long answer to that question is there's all sorts of things going on in various places. And maybe our allocation will not be reduced, but some money that we were expecting to come in to do something, and I've told you this before, the Scottish Government make allocations to NHS Lothian literally every month. We get our share, but if that allocation is not made or that allocation is curtailed, then there may be further financial pressures on it. So we don't know the answer to that question. We're crossing our fingers and toes and hoping it's not very much. So if I could take questions, Chair.
Thank you, David. I'll just open up for any questions or comments. Jonathan?
Well, sort of, well, a question is, so we're having a private session on this, are we, later? Is that the idea, David? So we're not, so really it's not really so much of a conversation now, or if it is, what specifically are you looking for now in this public meeting?
What I wanted to do was, first of all, ask if we could have a private session. I could go through the formalities. And secondly, write down all the things we talked about at the meeting, at the workshop, and provide some kind of background so colleagues who weren't at the workshop can see all this written down. And therefore, when we move into the private section, you don't have to have a recap of where we are. This is where we are. Now let's talk about how we can get out of it.
Okay, do we have any other questions or comments? David, the question I'd asked when we had our last finance development session was a number of announcements had been made, and one, for example, around it was building capacity in primary care. So there's certain, sounded like certain positive things were happening in the system, and it was just to find out as a result of those, if we'd heard any idea of what the finances for that would look like, because there was things around the bigger picture on the Tuesday, and then the next day was the programme for government, and there's quite a number of things in the programme for government that would have impact on health and social care, and it was just to find out what information was available on those, because there were some positive things in there. So at the moment, you're saying you don't have anything.
I have seen absolutely nothing, and I was at the National CFO group a couple of days ago, and there was nothing announced there. So I'm not aware of any more money coming in at this point in time.
Okay, and I just wanted to ask at 311, we're asking a recovery plans from both health and social care. Is there a rationale for each of them have been asked for 6 million? So looking at the budgets for each of the partners, NHS Lothian's got a budget of 2 billion. The partner NHS East Lothian Council of 300 million, like those figures will have quite a big impact on one partner than the other. So it was just a rationale of why 6 million was chosen for each partner.
Well, to be absolutely fair, there was no particularly scientific rationale. I think I wanted to make the point that this is a really, really serious challenge, and we need to do as much as is humanly possible. I think I also wanted to reflect on the point that, you know, the social care financial pressure is very, very significant. It really is. And we need to, and I don't want to, I agree with you entirely, I don't want to get constrained into, you know, this is the budget for this and therefore we have to deal with that. But we have to recognise where we are, and we have to recognise where the partners are. And the social care financial challenges is large. The model which works against social care is that, as you know, in future years we can make the presumption that health pay awards will be funded. We cannot make that presumption in social care. We know there's demographic pressures which are managed a different way in health, which are simply arrive as charges against the care at home budgets, for example, in social care. So I think I just want you to reflect the size of the challenges in both parties. I don't think the size of the challenges in both parties are the same. But I just, and again, this is not me saying you must deliver that. I'm simply reflecting we have very serious problems here. We need to address them. We need to do significant things.
Okay, thank you. I don't see any other hands up for any questions or comments. I think each of our finance papers that we've had, you know, outlined that we do have significant financial pressures and difficulties and challenges. And at the same time, I think it's really important to demonstrate everything we're doing to try and manage those challenges, but also at the same time keep reinforcing the fact that we're one of the fastest growing areas in Scotland, that these challenges are as a result of demand for social care and demand for health, and that's what we're doing is meeting that demand, and as a result that's why we're overspent. So it's really important to be doing both of those things to explain why those budgets are overspent, but you know, clearly articulating that as well, that those are some of the, you know, a lot of them are, as Lindsay had mentioned at our development session, our statutory services that you know we have to deliver. Okay, I think also your section on the set aside, that might be the basis of, you know, some of the questions in our development session on 3.6. What is set aside? You know, why is it overspent? What can the IJB to improve this position? And what are the resources that are available to the IJB to address that? You know, that would be kind of some of the basis of our development session on set aside would be helpful as well. Okay.
I think you make a really, sorry, may I? I think you make a really key point there. You know, we've got lots and lots of responsibilities. My responsibility is financial governance. I want to make sure the IJB is absolutely aware of what's going on, and I also want to make sure the IJB is doing absolutely everything it can, including keeping the partners informed of what we're doing, to make sure that all these matters we address this in the best way possible. So if we are overspent, we are overspent, having done all the things that we could possibly do. And as you say, Chair, it's largely about demand now, and that's the key point.
Okay, thank you. I don't see any other questions or comments. I don't know if anybody else or any of the officers wanted to come in on anything to what David said. Jonathan?
Yeah, sorry, me again. I guess it's just basic question is, David, you know, are we, Fiona as well, are we making good progress on those potentially optionality around the recovery actions, cognizant of what we said around, you know, residents and patients and delivery of services and the statutory service, etc. So I guess I know it's only a few weeks since we last met, but just a basic question: are we making good progress on that as we move into October and we have a more detailed sort of session on it?
To be honest, oh sorry, Fiona, do you want to take this?
Yeah, so we are making progress on it on the back of the last workshop. We still need to work up. I suppose the challenge for us is some of the actions will have lead-in time, and recovering that in year will be the challenge. And again, balanced with the kind of statutory responsibility of making sure that, you know, if we think of our strategic plan, we do not want to do harm to people. So in the next workshop, we've worked up further, Jonathan, just from where we were at the last meeting, so that we can bring decisions for discussion at the October IJB. But I suppose I just want to emphasise there still remains a risk, and we want to be really transparent around that.
Yeah, I
Okay,
mean,
does that help?
the thing part of that is the urgency of decision making, which we talked about obviously at that meeting, because we're already getting close to the half year, and unbelievably, and any decisions, as we discussed, getting made now probably don't come into effect for a number of months, if not longer. 6 million already, 7 million deficit. You know, that there has to be a sense of urgency from the partners, or at least an honesty to understand and acknowledge where we might be heading here in terms of those statutory responsibilities. So I'm just stating the obvious, what we talked about a few weeks ago, but I think, you know, worth saying, I guess.
Yeah, both partners have got this on their risk register. I know it's high up. I don't think there's any IJB that doesn't have financial sustainability or the financial challenges as high up, but I think for us it's more acute because our population growth. We're going to be having a development session after this. I think if there's any other, I don't see any hands up. If you have any other questions or queries, don't hesitate in getting in touch with David to go through any questions or queries. And we have that session about set aside where we're looking to see that shift in there. And also this paper does require a roll call, even though it is just for noting. Okay, Fiona, I'll pass it on to yourself.
Thank you, Chair. Yes, the roll call is required because the last recommendation requires agreement to an action on behalf of members. So I'll come to each member individually. Shameen Akhtar.
Agreed.
Thank you. Jonathan Blaisby.
Agreed.
Thank you. Patricia Cantley.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jordan.
Agreed.
Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously.
Okay, thank you. Move on to agenda item number 7, which is the National Care Service Scotland Bill Stage 2. And is that yourself, Paul?
It is, yes, thanks, Chair. Members will be aware of the contents of this paper, having been the recipients of a presentation at a previous development session. But the purpose of the paper is to bring you up to speed on the board's response to the Scottish Parliament's Health, Social Care and Sport Committee call for comments. And this resulted from the second stage of the National Care Service Scotland Bill consideration and some amendments that were proposed to the bill by the Scottish Government. So there was a process by which the changes to the bill were publicised more generally to elicit responses. And on the 1st of July of this year, the committee had a call for written evidence. Initially, there was a deadline of the 30th of August, but that was extended to Friday, the 20th of September. And members were given information on this bill and its changes on the 1st of August, as well as a number of web links to the substance of those changes and a very useful digest of the bill, which it's as a document to read without some interpretation is very difficult. So that was given to members, and as I said, we were also able to have a discussion about the bill intentions at the development session, where questions were answered as well as we could with the information that we had. So members were asked to provide their response by the 13th of September. We had 4 member responses from the committee, and I took these and consideration of other points made by our partners and provided the committee with the final East Lothian IJB response by the deadline of last Friday. So the purpose of the paper really was just to let you know that this work had been completed, let you know the nature of the responses that were sent to the committee, and to ask you to note the changes proposed by the Scottish Government and to note the contents of the response sent to the Health, Social Care and Sport Committee. The response in full is down at the bottom of the paper amongst the appendices, and I also took the opportunity to remind members what we said about stage 1 of the bill and the subsequent consultation and our response. So I'm happy to answer any questions from members.
Thank you, Paul. Do you have any questions or queries for Paul? I don't see any hands up. No, I don't see any hands up at all. Just to thank everybody who's made their contributions. We've had at the development session, you know, gave an introduction to this, so I really welcome the response that you've produced, and I've just picked out key things, and we've talked about this quite a lot, and I think, you know, you'll see a theme running right through all of our papers today. And I think our strength as East Lothian Integration Joint Board is that we're an East Lothian integration board. Local decisions need to remain local, and that's how we make the biggest difference to people's lives, and we can't lose sight of the bigger picture, as we're here to ensure that we get the best outcome for people living in East Lothian. We've also seen the challenges that we face and also how fragile the system is. At the moment, we've seen how fragile social care is. We've seen the levels of overspend that's there, the difficulties and challenges in the workforce, recruitment, etc. And so I think what really sticks out to me the most is that under those circumstances, we would hope that the people that be looking at all these responses will just take cognizance that the cost estimates of 600 to 900 million potentially being spent over the next 10 years is just unacceptable in this current financial environment. I don't think there's anybody that's going to disagree with that, but what we can do is we can ensure that if that money is reinvested into health and social care, we can address and challenges those difficulties and pressures that are faced. And I think a lot of the times when I've been to some sessions on the National Care Service, and the question that's been asked is that the system isn't working for everybody. Well, the system isn't working for everybody because it's been starved of the resources to be able to deliver it as effectively as possible. And if we had that resource, we could demonstrate without a doubt, you know, social work and social care and voluntary and community sector staff could absolutely demonstrate that we can make a difference and improve those outcomes that we all want. So for today, I'm happy, Paul, for the work that you've put in to submit that response. Okay, Lynn, did you want to come in?
Yeah, unfortunately I didn't, in terms of my own workload, didn't get an opportunity to contribute to the response that Paul put in, but I did contribute to the one that East Lothian Council put in, and one of the points that I made there was around, and it's some of what you were referring to there, Shameen, about the sort of the funding regime. And obviously part of that is the year-on-year funding process that we're all saddled with at the moment. And I did make a suggestion that actually maybe because there's some positive noise coming from the new Westminster government around a longer, 3-year funding approach, that actually maybe the implementation of anything around a National Care Service needs to be pegged to that, because we need to know that there's sustainability of funding in place for longer term projects, which really are about reshaping care. You can't do it on a year by year basis.
Yeah, no, absolutely. You're right, Lynn. Okay, thank you for that. Paul?
I should have said, Chair, at the end of my discussion on the paper, that whatever response comes from the Health and Sport Committee and the Scottish Government, I'll ensure that's communicated to members. I'm not sure what their time frame is for making sense of the consultation responses, but I would expect them to be able to give us a view on what people have said across the country.
Okay, thank you very much. I think we've got a really clear response from East Lothian. Jonathan?
Yeah, I guess just on that, obviously I'm aware somewhat of the health board responses to this, which are generally very negative, I'd say, or at least they are, generally negative. What do we know about other councils across Scotland? Does anybody have any intel on that? Is it, I mean, I in my involvement in this seems in the IJB and NHS Lothian, and it seems to kind of be a quite negative environment, and talking about this legislation in a very negative way, and as articulated in this response and in the NHS Lothian response as well, which is both very well set out. I just interested to know, other members hearing other views on this, a more positive view on this, and what the other councils done generally. Or do we know? Is there is you know, just interesting from my own perspective to hear any of that feedback.
Okay. Lynn, did you want to come in on this point, or was there something else?
Yeah, no, I can come in on that. I suppose as group leader, I've got contact with other local authorities, group leaders as well, and there's a range of opinions. I think people are very clear that they want to uphold the original principles of the review that set this whole thing in motion, but there are significant concerns. And just for information, there's a discussion at COSLA tomorrow, which might give you the answers that you're looking for.
Okay, thank you. Lindsay?
Hi, yeah, from a social work point of view, obviously I sit on the Chief Social Work Officers National Group and contributed to the Social Work Scotland response to the consultation. And the overall feeling is everyone is on board for improvement of outcomes for people. I am yet to meet anyone who believes that the National Care Service is the right vehicle from which to deliver them. So it's not about not supporting the kind of ideology behind it, but certainly a lot of people questioning the sort of the bill as is not landing well. That's not to say that no one will support it, but certainly the people that I am in communication with have real concerns. And at the moment, what I'm trying to support is COSLA's view that we need to separate the National Care Service from the National Social Work Agency. At the moment, they're very much intertwined, and what we're hoping to do is, their words, not mine, decouple those two advances so that we can really focus on creating that National Social Work Agency without it having to be dependent on a complete National Care Service. So yeah, supportive of change, not supportive of the proposed method would be my overall summary of what I'm feeling nationally, but don't quote me on that because others might love it. But that's the vibe from National Social Work Agency, National Chief Social Work Officers meeting.
Jonathan, that was similar to the chair and vice chairs of IJB, that we need less bureaucracy, not more. So just reinforcing the comments that everybody has made. One thing we can do is we can ask other IJBs for their responses. I'm sure they'll have meetings like ourselves and they'll be in the public domain. So if that's something that, Paul, you might be able to do if it's possible, to share that. But I'm absolutely sure that it'll be very, very similar. And when, my colleague Councillor Jardine was there as well when we did have the Scottish Government visiting East Lothian, and you were there as well. And one of the things we said really clearly is for an authority that's growing, we think that you just reconsider completely what you're doing with the National Care Service and reinvest that money into health and social care. So we made that, I know I was there as chair of East Lothian IJB, and my colleagues were there, that just to use that resource differently. That we're all committed to improving outcomes. I don't think we have an IJB meeting where we don't talk about outcomes and how we're making a difference. Okay. All right. I don't see any other hands up for queries or questions, so I'll wrap this up to say thank you very much for everybody's contribution. Thank you, Paul, for pulling all of that together. I think we've made a strong response, and hopefully they'll take cognizance of what you're saying. This paper is just for noting. The recommendations are for noting, so we don't need a roll call for this paper. Okay, I just want to thank everybody for coming along today and for your contributions and participation. That's the end of our IJB meeting today, and so thank you very much.